Item number 3, Senate Bill 2443 by Senator Roberts on third and final consideration.
Roberts, you're recognized.
Thank you, Mr. Speaker. I would move Senate Bill 2443 on third and final consideration. There is an amendment.
Senator Roberts moves passage Senate Bill 2443 on third and final consideration. That's second amendment, Mr. Clerk.
Amendment number 1, Commerce Committee Amendment.
Chairman Johnson.
Thank you, Mr. Speaker. The amendment makes the bill. I move adoption. Yield to the sponsor.
Senator Johnson moves adoption of the committee amendment. Doesn't require a second. Senator Roberts, you're recognized for explanation of the amendment.
Thank you, Mr. Speaker. The amendment does indeed make the bill, and the bill as amended, it corrects and closes a loophole in the current law which makes direct primary care physicians who provide primary care services on a fee-for-service basis vulnerable to the possibility of being regulated as an insurance company. And this bill, which has passed 14 other states, protects their ability to provide direct primary care without the fear that a future administration may attempt to inappropriately classify them as an insurer. So the amendment goes on to clarify that the providers have to be licensed primary or licensed physicians, and it does put consumer protections in it to protect the consumers who sign the contracts.
Amendment number 1. Voice vote. Those in favor signify by saying aye. Those opposed, no. We adopt. No further amendments. Discussion on the bill. Senator Harris, you recognize.
Thank you, Mr. Speaker, and I thank the senator for bringing this bill. And if he would yield for a question.
He yields.
Thank you, Mr. Speaker. I was impressed by this bill in a lot of ways, particularly the materials associated with the bill, which suggested that dealing with insurance companies can represent as much as 40% of the personnel costs associated with patient care. And so I think this bill does a good job of trying to get the insurance companies, to the extent we can, get the insurance companies out of the way of patient care. And I like what I see in this bill. You mentioned that other states have tried this as well. And so my question is, do you have a sense of what the monthly fee was in some of those other cases? If you could give us a range, that'd be helpful. Thank you, Mr. Speaker. Thank you, sponsor.
Senator Roberts.
Thank you, Mr. Speaker. We have looked a lot at the state of Oklahoma, who has been very successful. Their average monthly fee has been right around $30 for this service. And I do want to add that there's a possibility that a charitable organization or an employer could help subsidize that monthly fee, dropping it even lower. But what we've experienced in Oklahoma is around $30 a month.
Senator Hensley.
Thank you, Mr. Speaker. I'd just like to rise in support of this bill. This is a good piece of legislation. Allows primary care doctors to treat patients and get insurance companies out of the middle of treating patients. And it's very affordable to most people and allows them, most of the time, these fees covers lab charges as well as so many visits a year. There's many physicians already doing it. This bill is necessary so that this is not regulated by the insurance in the future. So I wholeheartedly support this bill.
Senator Bowling.
Thank you, Mr. Speaker. I rise in support of this bill. I think it's a very good step in the direction of talking about patient care, whether or not they have insurance. The important part is that we're getting the care delivery to the people, and I commend the carrier, the sponsor, for this bill.
CROWE.
Thank you, Mr. Speaker. This is a good step in the right direction, and I know we've talked about the potential for going a little farther, and we may have to do that next year. We'll see, or this may take care of it. But I would like to see us get back to the situation wherein someone that can't afford to pay for health care, yet has a skill, they're a mason, they're a bricklayer, they're a painter, they're a farmer, can pay for their health care in-kind services to the physician. And I hope we could get back to that kind of a bartering situation for those people that would like to do that. So we'll look it over and see if we need to do anything else for next year on that. And in the meantime, we'll talk and see if this takes care of that. And I think Senator Roberts is going to work to check on that and see if it does. Thanks.
Discussion on the bill. Next question. Question is put. Senator Roberts, would you like to close? Senator Roberts, you're recognized.
Thank you, Mr. Speaker. We have entitled this bill the Health Care Empowerment Act, and when I think about empowerment, I think about possibilities, and the possibilities that exist for this bill are very, very pervasive. I see the possibilities for patients. people who are frustrated with the rising cost of health care, people who are frustrated by the system that doesn't allow them to spend time with their physicians, and people have the possibility of going to a doctor in an affordable manner and spending time with their doctor. I also see the possibilities for doctors. So many doctors have expressed their frustration with not being able to practice medicine. They feel like that they're just simply practicing filing with insurance companies, filling out government forms. This is an opportunity for a physician not to spend 7 or 8 minutes with a patient, but 20 or 30 minutes. I also see the possibility for employers who can participate in these programs and help subsidize the cost of premiums. And it's a great tool for them to fight against the rising cost of healthcare premiums that our small business owners are struggling under. And I see the possibilities for churches and nonprofits to open clinics in parts of town where maybe there are people who struggle to pay for health care. And a church or a nonprofit could open a direct primary care clinic that could help meet the needs of that neighborhood. But most of all, I see the possibilities for people. I see the possibility for a healthier Tennessee. I see the possibility for lower health care costs. I see the possibility for the free market at work in its best possible circumstance to bring about the greatest delivery of health care, the best possible health care at the lowest possible price. And the great thing about this legislation is it does not require a government bureaucracy to do it. We are getting the government out of the doctor and patient relationship and allowing the doctor to charge the patient what they have determined that they can deliver medicine for. And this is a great solution. I do believe it's worthy of your consideration, worthy of your vote, and I would be honored to have any member who wishes to sign on as a sponsor of this legislation. Thank you, Mr. Speaker.
Situation. Question was put, said Roberts opposed, we're on the board. Those in favor of passing, vote aye. When the bell rings, those opposed will vote no. Clerk, vote.
Ayes 32, no nays.
Bill 2443, Henry City Constitution majority hereby declared passed.